Brandon, friend.
Jose, friend.
Alec, friend.
Nate, friend.
Okay. Bless you. Okay. Bless you.
Thank you.
As teenagers, we can't wait to grow up. We want to be out of the house and on our own, but we are so busy trying to get our life started in the direction that we want that we forget that our parents are growing old as well. They are the ones who have taken care of you for all those years, making sure you're okay, but it's your turn now. Your parents have reached that age that they need you to take care of them, but you're busy with work and kids, so you just don't have time to give them the full attention they need. So that's when you decide to put them in a nursing home. In order to pick the right nursing home, you need to know what it is, the reasons people are sent there, the services they provide, along with the costs. So let's begin with what a nursing home is. In almost every town, you'll find a nursing home, but unless you've been in one, you may not understand exactly what they are or what goes on inside. According to WebMD, a nursing home is a place for people who don't need to be in a hospital but can't be cared for at home. Most nursing homes have nursing aides and skilled nurses on hand 24 hours a day. They're there trying to make you comfortable, they're taking vitals and doing other personal cares when needed. Some nursing homes even have special care units for people with memory problems such as Alzheimer's disease. And most of them have units where couples can live together. So they're there trying to accommodate you, making you feel comfortable because they are trying to make it feel like home as much as they can. And although some of you might think nursing homes are just for the elderly, that is not true. They are for anyone who requires 24-hour care. WebMD states that most people get nervous when trying to decide if they should put their loved one in a nursing home or not because there are misconceptions about the care. One of the misconceptions is, once I'm in a nursing home, I'll never leave, which can be true if one has an illness or injury that progressed to the point where ongoing medical care is needed until the end of life. But many people go into a nursing home for the first time after sudden hospitalization, for example, like a stroke. So they're only there for rehabilitative care. Another misconception is, I or my family will get awful care. Although it is very important to thoroughly search for good homes, it's not true that all nursing homes provide poor care. Health and Aging also says when looking for a home, you can even find previous violations made in the facility to help you make your decision. That can help make you feel more comfortable putting your loved one in the care of the CNAs and nurses. Now that you know exactly what they are, you might be wondering all the reasons one is sent there. So why are people sent to nursing homes? Reasons for sending someone into a nursing home can include problems with activities of daily living. And those include walking, bathing, eating, brushing teeth, basically anything that you don't really have to think about. It is hard for family members to help their elders with all those things, so that's where putting them in a nursing home can be very, very helpful. And they can get all their proper attention because as a CNA, I make sure I'm always checking on everybody constantly, making sure they're having a good day and that they're comfortable. Also, Health and Aging reminds the readers that more than half the residents have incontinence. This can make a resident feel very uncomfortable, but to remind you, the workers are very well trained. More than a third have difficulty with hearing, seeing, or speaking, which can make care a lot more difficult, but necessary. People with memory problems can also be taken into nursing homes. And dementia, memory problems, communication problems, and depression are very present in a nursing home. They usually have separate units for those people because they do tend to get overwhelmed more easily. And according to Love to Know, they're just now adding this in most facilities as a required unit for the peoples with Alzheimer's and dementia because they were finding that they were not getting along with the other residents. And this helps with not only the resident stress, but the family members as well, and the CNAs and the nurses. Some just go for recovery from a serious injury and may not have to be there as long. A person may have a stroke where they need help with walking and moving other joints. So you may see patients in a nursing home that are just 50 years old, recovering from an injury. But as I said earlier, not everyone stays in a nursing home until they pass. 25% of residents are out in 3 months or less, 50% leave in a year, and 21% leave in 5 years or more. And Love to Know says that. Now that you know why people are sent to nursing homes, we can move on to the services that the home provides and the costs. The services nursing homes provide and the costs differ at each facility. So one nursing home may provide certain cares and the others may not. And that's why it's important when looking for the right nursing home that you make sure it provides all the services that you and your loved one are looking for. That's really important. And some services it may provide are medical services that are offered in hospitals after surgery, illness, or other problems. They provide kidney dialysis, orthopedic care, breathing treatments, support after surgery, rehabilitation, intravenous therapy. They provide antibiotics, help with wound care. They monitor medication, and they help with personal care such as giving baths and brushing teeth, all that kind of stuff. Also, that's not all they provide. They provide social and recreational care as well. It is important that the residents enjoy themselves with entertainment and social interaction. This can give them things to look forward to and increase mental health because, like I said earlier, depression is very common in nursing homes because they feel very lonely because their family's not there. But we try to do our best to make sure that that's not the case. So nursing homes will have activities such as bingo and crafts set up to occupy their time and give them an opportunity to bond with other residents. So now moving on to the cost of living in a nursing home. Costs vary with residents, apartment size, and types of services needed. So some people who need more breathing treatments and stuff like that, their costs would be higher. And the basic rate may cover all services, or there may be additional charges for special services. Most assisted living residences are charged month to month. And the average cost for a private one-bedroom apartment in an assisted living facility is over $3,000 per month. But it kind of depends on where you're located, like what town you're in. And also, it depends on your loved one's health insurance program or senior living care insurance policy, where some costs may be covered. Although putting your parents in a nursing home can be extremely stressful and one can often feel guilt from doing so, one can make the right decision just by knowing more information. As a CNA, I have seen so many bonds built between the residents and the workers. I have heard nothing but good feedback from family members as well. We do our best to make sure the residents are having a wonderful day and that they're very, very happy in the home. So understanding what a nursing home is, the reasons why they're sent there, the services they provide, along with the costs, it can make the loved one's decision a lot easier. And most people come to realize that nursing homes are not as bad as they think.